welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman, and here's what I bring to you all from the world of medicine. Treatment-resistant depression patients at higher risk of death. Patients with treatment-resistant depression have a 23% higher risk of death than other depressed patients. They also have twice as much outpatient care and spend 3 times the number of days in inpatient care. These are the findings of a new study published in JAMA Psychiatry by researchers from Karolinska Institute and elsewhere, who conclude that it is important to identify patients at risk of developing treatment-resistant depression. Depression is the leading cause of functional disability the world over. The most common treatments are antidepressants or psychotherapy. Many sufferers need care for months or years, but a significant share of patients never recover despite 2 well-implemented treatment attempts. They have what is commonly called treatment-resistant depression. Antibiotic resistance may be overcome by mapping E. coli. Antibiotic resistance when infection-causing bacteria evolve so they are no longer affected by typical antibiotics is a global concern. New research at the University of Tokyo has mapped the evolution and process of natural selection of E. coli bacteria in the lab. These maps, called fitness landscapes, help us better understand the step-by-step development and characteristics of E. coli resistance to 8 different drugs, including antibiotics. Researchers hope their results and methods will be useful predicting and controlling E. coli and other bacteria in the future. The researchers used a method called Adaptive Laboratory Evolution, or ALE, to replay the tape on the evolution of drug-resistant E. coli to 8 different drugs, including antibiotics. The method enabled the researchers to study the evolution of bacterial strains with specific observable characteristics called phenotypes in the lab. This helped them gain insight into what changes might occur to the bacteria during the long-term process of natural selection. Antiviral drug Nirmatrelvir plus ritonavir effective in reducing COVID-19 hospitalization among vaccinated adults 50 and over. The antiviral drug Nirmatrelvir plus ritonavir was granted emergency use authorization for treating COVID-19 in December 2021. In clinical trials, the antiviral was associated with an 88% reduction in hospitalization or death among high-risk unvaccinated individuals with COVID-19. However, little was known at the time about whether it could significantly benefit vaccinated individuals as well as individuals infected with novel variants of SARS-CoV-2 that were not dominant during the drug's clinical trials. By leveraging a large, well-validated COVID-19 data repository housed within their system, Mass General Brigham researchers confirmed that the drug is associated with a 44% reduction in hospitalization or death in a highly vaccinated population of adults over the age of 50. Study finds light therapy to relieve fatigue syndrome in multiple sclerosis. In a recent scientific study, a research group identified light therapy as a promising non-drug treatment option. Patients included in the study showed a measurable improvement after just 14 days of use. The study results were recently published in the Multiple Sclerosis Journal, Experimental, Translational and Clinical. For the first time, the research team relied not only on surveys but also on objective measurements when selecting the test persons. For example, sleep-wake disorders were ruled out in the 26 participating MS patients, particularly with the assistance of various sleep medicine examinations. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.